Portadown Community of Practice is made up of passionate and like-minded people from across a range of professional backgrounds who willingly share their time, experience, knowledge and resources to improve patient care. When we came together initially, our intention was to jump straight into a quality improvement project, looking at the early identification of patients with hypertension. However, what we quickly realised was that to lead change across boundaries, we needed to connect as a community, build relationships, listen to what matters, share the learning, and as a community create our own new knowledge.
My name is Phillip Lusty. I'm a GP in Portadown in Northern Ireland. I'm really excited to be a part of a community of practice. Over the last year and a half, we set about trying to bring together not just the GPs in the town, but to try and reach out to other professional groups. We're all so busy that in our own environment that we don't really know one another. If you meet to have something to eat and maybe a learning element and develop the trust that's required, you maybe create that space for innovation and creativity.
My name is Helena Buchanan and I'm a practice-based pharmacist at Riverside GP practice here in Portadown. I'm part of the leadership group within the Portadown COP. What has the COP meant for me? I suppose the big thing is thinking outside the box.
My name is Raymond. I'm a community pharmacist in Portadown. I've been practicing here for coming on 40 years. One of the biggest changes I've seen over the last 10 to 20 years is just how the relationship between GPs and pharmacists has, to a certain extent, fractured in that we have less contact and less communication. But I think the thing is with the COP, it is we're working with the population more of the people that we're actually working with, so it's the practitioners in this area, it's the pharmacists in this area, it's the individuals and it's the patients.
The growth and development of our community over the last 12 months has really exceeded our expectations. We've invested time building trust, and as that trust has increased, openness, mutual respect and transparency has grown. The community of practice has a genuine passion for collaboration to effect change. We're no longer constrained or limited by organisational boundaries. We realise that together we are better.
The biggest thing that we really, I think, have achieved, or one of the biggest things, is the trust and the relationship building within the group that has happened this year, and really hope to build on that on year 2. We've started a leaflet distribution of the access and information for the trust, so we've built really good relationships there, and that's in all GP practices and community pharmacists in the area. We've also engaged secondary care. We're really hopefully starting a very exciting project with a consultant paediatrician in respiratory and secondary care, and looking at inhaler use, and that will involve the GPs, the practice-based pharmacists and the community pharmacists. So it's a primary secondary care thing, and to be honest, it wouldn't have happened without the input from the trust quality, and also the head of pharmacy from secondary care and our local hospital attended our last meeting.
Over this year, our community practice has grown and we've introduced different people to that community, and as we've formed a relationship with the GPs and the pharmacists, we've now gone out and involved patients. We're at a stage now where we have a few ideas and a few of what matters to us as practitioners, but we want to know what matters to the patient as well, and listen to them as equal partners.
I would be very encouraged with the past 12 months. While meeting together sometimes on its own, people can sometimes feel that it doesn't achieve anything. I think over the past 12 months we have achieved quite a bit, and that is in terms of developing trust and relationships to the point where we can now begin to really address some of the issues, the key issues, which are causing problems in the way we practice.
What we need to do in year 2, we have engaged members of the public and patient representations, and we need to work on that. And also we need to get more GP practices involved as well. We're bringing on the practice-based pharmacists within the health centre, which is very important, along with the community pharmacy colleagues.
But imagine the power of multiple communities of practice within a region that can work together for the wider regional approach. That is something that excites me.
So for the future, I think it's not a matter just about meeting just for the sake of meeting. I think it is about building trust, building relationships, and when those then are, a foundation of those is laid, then I think we can begin to build and try and change maybe some of the ways in which we practice.
We now need to engage with like-minded people across our local system and invite them to get involved. We want to grow our community with the support of Q and its membership, because we can make a real difference, because as we know, people own what they create.